Good evening, everyone. Thank you for taking the time to spend the next 45 minutes to an hour with me. Today's lecture's on posterior composites, and just trying to discuss a few ways to make them easy and also profitable in your practice. I mean, it's important to have both. So, my name is Dr. Paresh Shah, and before we get started, I just want to give a couple of acknowledgments, and one of them is to Dan Serona, the Restorative Division. Thank them for supporting this this webinar. If it wasn't for the help of some of our manufacturers, we wouldn't be able to provide some complimentary continuing education like this at the convenience of your work or home. And also to the Catapult group, and they're a group that I've been involved with for quite some time, and it's a speakers group, which I will explain a couple of things for you in a moment. This is my contact information, so if anyone has any questions, probably the best way to get a hold of me is through my email. And if you want to, if you have any questions or need any further information or clarification on any of the topics, I'd be happy to do that for you. I mentioned Catapult Group, and they're a group of clinicians and educators that are throughout North America, and we work to provide dental education to a variety of dental groups and organizations in the form of webinars and live lectures as well as workshops. So if you ever are in the need of wanting to have some great education, I would check our website, and we have some fantastic educators with great resource for everybody. As a disclosure, most of the photography that I've taken has been on patients of mine, and they have not been altered in any way except for maybe cropping to fit the slides. There are a few slides that have been borrowed by other providers, which they'll be acknowledged on the slides. I also serve as a consultant for a variety of dental manufacturers, and I just want to clarify that I've been fortunate to work as a consultant for a number of them, and there are from time to time products for evaluation that are provided complimentary, like some composite or impression materials, bonding agents, things like that. But for those that I choose to use on a regular basis ongoing for my practice, I do pay for them. So it is not something that everything is complimentary. I do pay just like all of you would. My background, I am from the University of Manitoba in Canada. I did my dental degree there. I do have a hospital GPR, as well as a certificate in aesthetic dentistry from the University of Buffalo, and I also am part-time faculty at the University of Pacific in San Francisco. I've also done a program at the University of Minnesota in Buffalo in the aesthetic program, and I run a study club as a director for one of the Seattle Study Club affiliates in my city in Winnipeg, and I'm also a Coyce Center graduate, for those of you that know John Coyce out in Seattle. So now, today's webinar, our focus will be on Class 2s, and what I'd like to accomplish for the rest of the time is to discuss how we can get some proper contacts and contours when we're doing our Class 2s, the importance of an isolated field, and how a good sectional matrix helps us achieve that. How to protect the adjacent teeth and allow some efficiency and speed with your preparations, and then how we can do quadrant dentistry with Class 2 composites in an efficient manner using a sectional matrix. It's been a challenge for years trying to be able to do multiple composite restorations at the same time and save time and have it productive for our busy practices. And I'll share some tips on how I do that in my practice and make it profitable but also predictable. So let's start with posterior restorations. Well, why are we talking about that? First and foremost, if we look at posterior composites, they're basically the foundation of our practice. Like on average, close to half of our restorations that an average practitioner will do in a general practice will be Class 2 restorations. And for that reason, it's important, because if we can't do it in a time-effective manner, and we can't do it predictably and reproducibly, it gets very costly, because we have the potential of having patients coming back to have work redone because of sensitivity, because of food impaction, because of poorly contoured restorations, and that obviously costs the practice money and not only the inconvenience to the patients. So it's important that we make sure that this foundational procedure is as predictable as possible. How do we determine success? Well, I mean, obviously if there's no pain and the restoration lasts and there's no food getting stuck between the teeth, that's what we want. And just by looking at follow-ups, we'd like to have something that will look as sharp and as properly contoured as possible after 11 years or even longer than that. The same thing with this restoration. So success is just longevity and having them being asymptomatic over a period of time. We want to have proper contacts and contours. Those are important things to have. However we place them, whether we're using a conventional matrix or a sectional matrix, it doesn't really matter. The bottom line is we want to have the same end result. Now there are some systems that will help us accomplish that better. We need good embrasure form. Our final contour has to be good, so that when we look at the original teeth and we look at the new restorations, that it should be in a very harmonious manner and be natural to the patient. And that's what we're trying to achieve. What are some of our challenges with posterior composites? Well, technique sensitivity is a huge thing. We have to be sure that we have good and adequate moisture control. Our depth of cure is a challenge. If we can't get the light in the right spot to cure completely the composite that we're placing in there, that creates a challenge. That risks having leakage, having sensitivity, and having failure ultimately. And then of course the contours and contacts. It's been really a lot easier to do that with traditional amalgams. And so posterior composites are also they can be time consuming compared to traditional amalgam restorations, where we could just place the restoration in, we can condense it really hard, we create these tight contacts, and then they harden and set and we're done. So we can do multiple restorations really fast at the same time. However, a lot of our patients don't want those types of restorations, so we have to figure out ways to counteract some of these challenges that we have with posterior composites. And it becomes harder to do quadrant dentistry with posterior composites for the simple reason, as I had mentioned with amalgams, we can do multiple restorations. We can pack them all at the same time. They harden, and all of a sudden we have these nice tight contacts. But with composites, we have to use some sort of an instrument to pack them against traditional matrices, and that creates a challenge trying to do multiple restorations at the same time. So what's one of the #1 reasons why composites fail? It's recurrent decay. And it's usually at the floor of the proximal box of a class 2, which is the most vulnerable. And that's a lot of different reasons. The flowability of the material that we're using, how the matrix system is placed, the wedge that goes in there as well. Can we get a light to cure this restoration adequately enough? All of those things play a role. With posterior composite, traditionally we have it's more time consuming than the other restorations, and so the technique sensitivity has created, I feel, like a negative reputation for direct composite restorations, and I think there are ways that we can combat that. So how do we start? Where do we start? Well, one of the first things I would suggest is isolation. It's very, very important. And I think if we can find a way to isolate properly, it will make our lives that much easier. What are the challenges with traditional Toffelmine matrices? Well, first and foremost, if we don't have it adapted properly and we don't pack or condense our material adequately against the adjacent contours of the adjacent tooth, we can fail to restore our proximal anatomy properly. And this can lead to a thin point contact, can certainly lead to a gap where you'll have like a food trap, and This area, because it's very thin and almost a point contact, we risk having fracture of that marginal ridge, and not to mention risk periodontal problems by getting food impacted in these large embrasure spaces that aren't closed adequately enough. So those are some of the challenges that we have with our traditional matrices like Toffelmine's. So traditionally, we needed to use wedges to separate the teeth in order to create these nice tight contact areas and these proper emergence profiles. We also need to, with that, we need instruments, and those instruments might be a plastic instrument or even a metal instrument or some sort of contact former that we have to place inside our composite when it's being placed in the matrix, and then use some degree of pressure against the adjacent contact and light cure it so that it holds the shape against the contact area. The combination of doing that allows us to create some natural contact areas. With amalgams, we don't have that issue because the way the material is, we can pack them in adjacent restorations and use pressure to condense the amalgam in, and all of a sudden as it starts hardening, our contact area is nice and tight. But with composites we can't, because we have to light cure it in order for it to set. So we have to do individual contact areas at the same time, rather than doing them at the same time. So wedging is also important to create the contact areas. And if you see on the figure on the left, when we're using a conventional matrix, the wedges are placed between the teeth to allow a little bit of separation of the teeth. And then when we remove the wedges, the teeth will flex back into position because we're actually just kind of working with the PDL in that area. And it allows us to compensate for some of the width of the band. And that's what we needed to do for the longest time with conventional matrices like the Toffelmine Matrix that you see on the right-hand side. There has to be a better way. And there is. Nowadays, we have other systems that allow us to create these nice contact areas. And so they become a lot simpler now. So what do we have that makes our Class 2s easier? Well, one, our sectional matrices and ring systems, which have revolutionized how we do posterior restorations. We have universal bonding agents, which I'll cover a little bit shortly. And then bulk fill composites. And these bulk fills have also allowed us to shorten the amount of time that we place our restoration and eliminate a few or reduce some of the issues with post-op sensitivity and polymerization shrinkage. And it allows us to do multiple composite restorations simultaneously if we use these systems together. So let's talk about the ring and matrix systems. Well, traditionally, as I said, we learned how to place Toffelmine matrices, but the problems with that are contacts and trying to create good tight contact areas. When the first sectional matrix systems came out, they were made out of nickel, actually not nickel titanium, they were made out of stainless steel. And the sectional matrices are counterintuitive from our conventional Toffelmine matrices. What they do is the ring that's placed between the teeth is creating separation of the teeth. So we're not counting on the wedge to separate the teeth. The wedge is placed to allow the band to, or the matrix to actually adapt to the box on the floor so that we can minimize or eliminate an overhang. But the rings will actually help separate the teeth. And when you remove the rings, the teeth spring back into position and we have a nice tight contact. The original ones were made out of stainless steel, and what would happen is after they would work harden, and then they wouldn't have the flex and you wouldn't get teeth separating, so you'd throw them away and start with new ones. Well, when I originally started placing sectional matrices, I was still a little skeptical that I was going to get the nice tight contacts that I was promised, and so I would still use a contact former. But after a while, I realized that even with these sectional matrices and these rings, I was getting really tight contacts, and I did not, for most teeth with normal anatomy and root root proximity between adjacent teeth, you can place these composites side by side and have nice tight contacts every time. And so after they were done, you have nice normal contour. And sometimes, honestly, they are hard to remove these bands after you've removed the rings. So what are some of the solutions that we've had with, or what solutions that sectional matrices provide? Well, first of all, they are easy to use. It's not very complicated. The bands are naturally contoured, so we can get a variety of sizes, lengths, even some shapes that anatomically fit where we need them. And you can get contacts at the proper height of contour. And sometimes the contacts are so tight that you actually need a hemostat to remove them. So that's one of the things that we can count on, is that allows us to do multiple restorations at the same time, because the rings do compensate for the thickness of the bands. So what are one of the key systems that are available? I mean, I've loved the Paladin Plus system, and the reason being is I like the way it's designed. They've been around for quite some time, quite a few years. I've been using this ring system for over 5 years, and with consistency. They are made out of nickel titanium, so that's shape memory alloy. And the one nice thing about that, that's used in the cardiac industry for stents. It's also used in the orthodontic industry with orthodontic wire nickel titanium. But the nice thing about it is with the forceps that come with for placing these bands or these rings, you can actually retighten these rings to create that flexibility again between the teeth, so for separation, so we can continue to use them for a long period of time. They also have matrices that are contoured at the marginal ridge, so it allows you to have some shape. If you place this matrix and leave it about a ½ millimeter above where you want the marginal ridge, it's really easy to go back with your favorite burr or finishing strip and contour that marginal ridge nicely. They've actually got anatomical wedges that can be stacked on top of one another to allow good adaptation as well. And there is a longer extended band as well for those deep restorations. And then I'll get to this last one, is your wedge guards. Allow you to kind of speed up your preparation and protect the adjacent teeth. So the wedge guards, as I said, allow you to speed up your restoration. What you can do is place them before you start your preparation, and this little metal band will actually be removed once you're ready to, once you've finished your restoration. It protects the adjacent tooth and the soft tissue during preparation, but the wedge will actually pre-expand a little bit with contact, and the metal guard can be removed afterwards. So it's quite a handy tool to have. This is what it looks like when you're placing it in there. And if you're going to, if you're going to be prepping a little bit fast, sometimes it's possible to nick the adjacent tooth. This will definitely protect you from doing that. The other thing that this matrix system has are what's called Easy Coat matrices. And these Easy Coat, they're basically thin, non-stick, almost Teflon coated to allow so that the composite doesn't stick to them. And you can actually get ones that are a little bit more contoured so that you can actually almost build up a cusp on each side, which is kind of nice. The wedges are flexible and you can stack them. There are a lot of times where I'll end up placing multiple wedges. It all depends on what I need, how the contour is, what the embrasure spaces are, and quite often I will stack them from across, one from the buccal and one from the lingual. So it's whatever it takes to get it to get the matrix band adapted properly. You certainly can contour these bands when you place your them to make sure that you're happy with the shape before you place your restoration. And as I showed you here, as I had mentioned earlier, this is how you can actually place two wedges simultaneously from opposite ends as well. And the rings can also be stacked. So if there's enough space in coronal height, and depending also on where the rubber dam is placed, you can actually place two, sometimes the most I've done is 3 rings that I've stacked on top of one another. And that allows me to do multiple restorations. So if I had a mesial on this molar and a distal on that bicuspid, I could have one more matrix right here and another one here, and all of a sudden I can have 3 teeth that I'm working on at the same time. Now, for those of you that are wondering about Toffelmines, and you love the Toffelmines, you don't have to get rid of them, because if you can get the Toffelmine placed in the right spot, and let's say you're missing a cusp and you wanted to build that up and you didn't feel that this matrix, the small matrix with sectional was actually adequate enough, you can use the ring with the Toffelmine. And I've used that numerous times as well. The key is the ring is allowing you to separate the teeth to create that nice contact area, nice tight contact area. And that's the key when you're trying to do these posterior composites. Now, before we go to some clinical cases, I want to talk a little bit about adhesion, because that's really, really important as well. So let's talk a little bit about that. What is adhesion? Well, adhesion basically involves removing a mineral portion of your tooth, it's the calcium phosphate component, and replacing it with acrylic. Now, when we're doing that, it almost seems counterintuitive. How do you make that happen? Well, the key is we have to understand a little bit about the histology of the tooth. Enamel, it basically consists of an inner material. The majority of it is hydroxyapatite, and there's only about 10% of it that's protein and water. When you dry it out, you get this hydrophobic surface that allows us to bond. And what we want is we want to expose enough of the enamel prism rods in the enamel to allow to enhance micromechanical retention. We know we get really high bond strengths to enamel, but it's basically an inorganic material. It doesn't like water. So let's just call enamel hydrophobic. With dentin, it's composed primarily of 60% inorganic material, which is mineral hydroxyapatite, but 30% of it is collagen and about 10% is water. And the collagen is not found in enamel, and it typically is a helical strand on dentin. Now, as you get deeper in the dentin and closer to the dentinal tubules, you get some influence from the pulp, and there's some moisture in proximity of that. And so we need to have some component that also is moisture tolerant. And so dentin essentially is a hydrophilic component because moisture is friendly to it to some extent. So we have enamel that's hydrophobic and we have dentin that's hydrophilic. The other thing that we have with the tooth is your smear layer. It's hydroxyapatite, collagen, and tooth debris. It's over the pulpal floor, and it's believed to serve as a barrier to bacterial invasion. So a lot of our composites have been derived by or developed by how they react to the smear layer. The earlier generations would modify or attach. The classic 4th and 5th generations, the total etch, they remove the smear layer completely, open up the dentinal tubules to allow penetration of the adhesive into the dentinal tubules. And the current 7th and 8th generations, they basically incorporate the smear layer into the bond. So that's where the technique sensitivity goes away. So with enamel and a total etch, this is the classic total etch technique. What we're trying to do is remove, we're trying to get micromechanical adhesion to enamel by exposing as much of the enamel prism rods. And so preparation kind of helps with that, and phosphoric acid. And there are a couple of articles that I've cited in here that talk about bonding and adhesion. And one of the key things with both of these articles that I've cited are that they looked at if you can they looked at the increase in bond strengths by scrubbing action, and they found that by using a stiffer microbrush you could actually increase your bond strengths. That would imply that scrubbing of your bonding agent does help enhance bond strength. So the recommendation is to do 15 to 20 seconds, at least 20 seconds on enamel of phosphoric acid, ideally prepped or cut enamel. Rinse the phosphoric acid off, lightly air dry, and then apply an adhesive for at least 2 times 10 seconds minimum each time, scrubbing it into the restoration, and then air drying your solvent after that, and then light curing a minimum of 10 seconds. You can never undercure. Should always get your lights checked, because the intensity of the light, if it drops in any way, you're going to compromise your bond of not only your adhesive but also your composite. With Dentin bonding, it involves, especially with the total etch technique, what you want is you want to expose the collagen fibers that are over the pulpal floor. And so what you're doing is you're removing that smear layer, and then you want to have the adhesive actually penetrate down into the dentinal tubules and to create this hybridization zone. So with a total etch technique, as I said, we're removing the smear layer, we're counting on micromechanical retention to enamel, but we're also exposing the collagen fiber matrix around the dentinal tubules as well. Those are all key. So moisture is key with dentin bonding. You want some moisture, but you don't want it to be over wet. You also don't want it to be over dry. With dentin bonding, the key is, if you're placing phosphoric acid on it, to keep it on for a shorter period of time than enamel. And that's why having a viscous etch will help, because you can place it over the enamel and then you can put it in the dentin for a shorter period of time. I always time my when I'm doing a total etch technique. And we're going to rinse it off, and then we're going to apply and scrub our adhesive over the entire restoration, just as before. 2 to 3 coats, 10 seconds each time, scrubbing it in, and then air dry after that last coat, and then light cure for a minimum of 10 seconds. So the key with dentin bonding, with a total etch technique, is you want to remove the smear layer to open up the dentinal tubules so you can allow the adhesive to penetrate all the way into the dentinal tubules. And with the total etch technique, some of the keys here is, if you over dry or over etch, you'll destroy the collagen fiber matrix around the dentinal tubules, and you really want that collagen fiber matrix to stay put so that it allows optimal bonding. So there are self-etch techniques where you can actually just place your adhesive directly over both of the restorations, and it's got a mild acid inside the etch, but the bond strengths to enamel are not as high as when you use phosphoric acid. Well, so how about the best of both worlds? High bond strengths and reducing the technique sensitivity. Well, a selective etch technique is the way to go. And now a lot of our newer generation adhesives have not only phosphoric acid, like a mild acid in there, but it allows us to use it in 3 different ways. It allows us to use it so that we can actually use it as a self-etch, as a full etch, or as a selective etch. There's no ideal adhesive, because most of them, when it comes to a total etch or a self-etch, what we basically are looking for is vigorous scrubbing of our adhesive during the which allows us to increase our bond strengths, prolonged light curing, and ideally a warm air dryer if you have it, something that doesn't express moisture. So, for example, primer bonding elect is a great universal adhesive. What it allows us to do, it gives us the flexibility of using the adhesive in 3 different ways. As a total etch, where for those of you that like to place phosphoric acid over the dentin and the enamel, we can use it that way. For those that like to just take it out of the bottle and apply it over the tooth without any phosphoric acid, you can use it. It's great for class 2 restorations. And for those that like to use phosphoric acid on enamel but not on dentin, you can use this same product where you can selectively etch only the enamel and not the dentin. And so it gives us the best of all the worlds. Okay? So these are the 3 different ways that we can use primer bond elect and some of the other universal adhesives that are on the market. Now, when we're going through with our composites, how do we manage some of the challenges that we have? Well, one of the big things is managing shrinkage stress. This is a key thing, because it can lead to debonding, marginal staining, secondary caries, cracks, post-op sensitivity, all of those things. And some of the things that will contribute to that are improper curing. If we don't have proper curing, we can run into all of those issues. So it's important that we do make sure that we've got an adequate curing light and adequate depth of cure. And some of our materials will help us accomplish that, but also our lights. We have to be sure that the light is shining properly on the tooth so that we can actually cure it at an adequate depth. And the curing angle plays a role, because if we don't have it angled properly, we can end up with undercured composite. I like to actually use two curing lights so I can actually cure from both sides at the same time, and that kind of minimizes some of the risk of having portions that are undercured. Polymerization shrinkage, how do we deal with some of it and increase some of the efficiency? Well, bulk fill composites. There are several of them on the market. There's one that I absolutely love. It's Surefil SDR flow. I've been using it for over 5 years. It's a bulk fill resin that's actually self-leveling, and it has fairly low polymerization shrinkage, which is very nice. So when you place it in there, it actually does settle very well. It's low shrinkage. You can cure it in 4mm increments, but it does need to be covered with a durable hybrid composite over any stress-bearing or occlusal load areas. And if you look at this video, you'll actually flow. One of the key things with that you saw in that video is making sure that the tip of the delivery of your stays within the composite, so that, and you don't rotate it and shake it around and mix it. You just place it within the composite and inject out, and that way you won't incorporate any voids or bubbles. And you can see it on a radiograph, which is very important. You need to finish with a hybrid composite. So one of the composites that I use is the TPH Spectra. And the interesting thing about TPH is that it comes in two viscosities, a low and high. So if you're looking for, if you prefer to have a composite that has a specific type of consistency, it allows you to do that. For those of you that like low viscosity, soft handling, you've got that. For the high viscosity, firm handling, you have that available. And then there's a great variety of shades that you can get with it as well. And you can use a smaller, simpler shade guide. It doesn't have to get overly complicated. So, and then when I polish these restorations, I typically will use Enhance or Pogo. And you know, for the initial polish, I'll use the Enhance, and then to get a nice shine, I'll use the Pogo, because we can anatomically get into those deep areas. I also like sometimes using a silicone carbide brush. I typically don't use it with a polishing paste, but you can use it, so I usually use it dry. So let's look at a few clinical cases now. You know, here is a matrix system. Now, how do I place them? I basically will do multiple composites at the same time. Using this sectional matrix system, I am able to create nice, tight contacts and contours without having to do each of them individually. When you normally do a Toffelmine matrix with amalgam, for instance, or even with the composite, Toffelmine matrix with the composite, you can prep all the teeth at the same time. You will place your Toffelmine matrix over one of them. You have to essentially finish one to completion, take the Toffelmine matrix out, finish polishing and contour, curing, and then you go ahead and place another Toffelmine matrix on the next one. And you're counting on the wedge to separate, so it's not enough separation. Quite often you will end up having a gap and food impaction. With the sectional matrix, because the ring actually separates the teeth, as long as you get the bands contoured to your satisfaction, you can sequentially fill both of these restorations up at the same time before you remove the apparatus. So what I'll do is this is a total etch technique, obviously. In this case, I'll place my phosphoric acid, I will remove it, I will place my adhesive, scrub it in, minimum 10 seconds between each coat, air dry it. Now you've got that nice shiny appearance. That's what you want. If it looks matte finished after you're done, that's not good. You should add another coat. It should always look shiny. Once that's done, fill one of them. And here's the Surefil flowable. I'm filling that not up to the top. I'm leaving about a millimeter, millimeter and a half over top so that I can put a hybrid composite over top of it. Once I finish that one, I fill the next one. That is my preference. And after I'm done, then I can remove the apparatus. I can remove the bands, and I got these nice tight contacts and a nice contour. And believe me, they are hard to remove. They're not easy to remove after you're finished. Now when you look at it on a radiograph, you should also be able to see nice tight contours and contacts. You can tell the difference between the Surefil and a hybrid composite. There's slightly difference in radio opacity, but you can see both of them on a radiograph, which is nice. Here's another case. This one here, we have multiple restorations at the same time. We've only got one ring, and what we've done here is I will start on one and then I will fill the other, and essentially I'm able to do all of them at the same time. So how does that help? It allows me to shorten the amount of time. If you're doing an amalgam and you're doing, say, 3 restorations in one quadrant, I mean, it's going to be really fast. Am I going to do 3 composites in the same quadrant at the same time? No, but I can shorten the amount of time by probably 50%, which makes it more profitable as well, and I still get these nice tight contacts and nice contour areas. So that's a huge practice builder for your practice. Now here's a situation where I'm putting 2 rings at the same time. I'm doing the mesial and distal, it's an MOD. If I had another restoration on the bicuspid, I could have one more band right here, and I could do both of them. Just turns out I didn't have that, but you can stack rings over one another. It allows you to actually finish both sides at the same time. I'll apply my adhesive, place my my flowable, and you can see as I'm injecting the flowable, I am keeping the tip within the composite. So as I'm pulling it out so that I don't leave it outside, I keep it within, and then I stop, and then I can I'll cure it obviously, and then I'll place my my hybrid composite over top of it. Now what I like to do is also, as I said, cure from both sides. I'll take the bands, do the same thing after I remove them. And remember I mentioned that I'm placing the matrix slightly above where I want to finish the marginal ridge, about 1/2 millimeter above, because that allows me to take whatever favorite instruments that I have and just kind of reshape it and polish it and get rid of any flash. And a lot of the times I will, if I'm really busy and I don't have enough time, I will fill everything and then I will shape my final restoration with burrs. If I have time, and if you prefer to do it that way, you can take an instrument that actually looks similar to this acorn or whatever favorite instrument you have, and before you cure your final hybrid layer, you can shape everything and then cure it, and you have minimum finishing to do and anatomy to do. But if you want to just bulk fill everything, I recommend this burr. It's kind of an anatomical shape burr, and I can carve in some of my anatomy. And then I like using a multi-fluted carbide burr. It's a flame-shaped burr that works really well. And why do I use a flame-shaped burr? Because on a flat edge, it doesn't gouge your restoration. I can remove any flash that I have. I then like using a diamond finishing strip, not a coarse one, but a medium grit one, so that I'm not medium or fine, so it's not opening the contact but it allows me to finish if there's any flash on the box. So that's nice. And then I'll finish with my my enhanced and my pogo and silicone carbide burr if I need that polisher. So it allows you to get all your restorations, you know, in a timely manner. So, now, can you build it up anatomically? Of course you can. For those of you that prefer to do that, this is a liner that I place inside, and then I'll do my bonding protocol over it. I'll place my adhesive, and then I'll air dry, and I'll place my Surefil, and I'll build it up. Now, I didn't take this all the way up to the biting surface because I don't want to finish in function, and now I can build up my marginal ridge and slowly build up each cusp individually, and there's that instrument I was telling you about that shapes the final restoration. So I have very little finishing and polishing to do after. So you can do it either way. The advantage of the bulk fill flowables is that it allows us to now minimize the number of increments that we have. If you're doing multiple restorations, it can save you several minutes per quadrant. But the big savings comes from the sectional matrix system. Palette Plus and the rings just allow you to do multiple restorations in significantly less time than a Toffelmine matrix system with just regular wedges. And then, of course, as I said, I like using the diamond finishing strips to allow me to get the final flash out from interproximal. But I don't get rid of my Toffelmine matrices. There are times where I do need the Toffelmine because maybe an anatomical restriction doesn't allow me to place a band in the right area because, let's say, the rubber dam matrix is in the way, the rubber dam holder is in the way. And so I'll use a Toffelmine matrix, but I'll still try and use the ring because the ring will allow me to have a nice tight contact and contact area. And so that's where I can still take advantage of the ring system, and it allows me to still get that contour. And for those of you that like to burnish your bands, of course you can burnish your bands. You feel free to do whatever you need to get the anatomical contour that you want. But I do both of them at the same time. The thickness of the bands for the most of the teeth that you're going to do are going to be just fine because the ring system will separate them enough to allow proper contact areas. And here's a selective etch technique. I'm doing two restorations at the same time, placing my phosphoric acid only on enamel, placing my adhesive in both areas. I'm going to fill one restoration at a time, and then I'll complete both restorations and take the bands out at the same time. Here's one more with basically two adjacent teeth side by side. I love using this instrument because I can actually shape the anatomy of it. I finished filling that one, as you can see. Now I'm filling the second one, and then I'll take my favorite instruments to finish the restorations and polish them up. And then the silicone carbide burr just to shine up any of the anatomy. But again, whatever favorite instruments you like, it's totally your preference. But some of those systems that I spoke about over the last 45 minutes, they're really key to the success of doing posterior restorations. So in recap, what do we have? Well, essentially, we have a selective etch technique with universal adhesives. What do they allow? They allow optimal bond strengths, minimize technique sensitivity. Why would we recommend bulk fill composites? Well, we have flowables that are very convenient. We can get an increased depth of cure with them, and it allows us to speed up the placement of the restorations and minimize some polymerization shrinkage issues. And then finally, the most important part of it is the ring and sectional matrix. It allows us predictable, reproducible contacts for posterior restorations. They work well with bulk fill restoratives, and they allow us to save time. We get nice, predictable, tight contacts and contour areas. So I hope all of you got a few tips out of what I just spoke about. I will entertain any questions and my email is the best way to get a hold of me. So thank you very much. It was a pleasure.